Ashwepe, this is Nurse Nikki. Just wanted to let you know this man is leaving the floor. He isn't really feeling too well. He's not breathing too great, I don't think.
Well, what's wrong with him?
I don't know, he just isn't breathing too well. He's just been laying around all day, not doing too much.
That doesn't tell me anything, you incompetent nurse.
I just think that you need to come in and see what's the matter with him. I can't figure it out. Since you're the doctor, you need to fix him.
This phone call is no longer effective.
Hello, Dr. Ashwepe. This is Nurse Nikki. I'm calling about Mr. Longbottom in room 227. He is complaining about shortness of breath of new onset. He is 89 years old with a stage 3 diabetic ulcer. He has lost a significant amount of weight over the last month. He has no prior history of cardiac or lung disease. He has been confined to his bed for the last month and a half. His vital signs are temperature of 98.7 degrees orally. His pulse is at 102 beats per minute. His blood pressure is 80/50 and he is sitting at 85%. He has decreased breath sounds on the right with acknowledgement of 9 out of 10 pain. We started him on 2 liters of oxygen. I would like to rule out pneumothorax. I think that the patient should be further assessed now. Are you available to come in?
Thank you for your information. I think your assessment is accurate, and I'll be there right away.
Hello, Moses Cone, 2 West. This is Colleen. How can I help you?
Hi, I was just letting you know I'm gonna be late to work today. Would you mind letting the charge nurse know? Great,
Okay,
thanks.
who is this? Oh. Moses Cone, 2 West. How can I help you?
Hi, Colleen. It's Mary Rascala, the nurse who will be coming in tonight to work from 7 p.m. to 7 a.m. I just wanted to call ahead and let you know I'll be running about 10 minutes late as there is a lot of traffic on the highway this evening. Would you let the nurse I am leaving know that I'll be there as soon as possible?
Sure, Mary. I will let your nurse know that you'll be running a couple minutes late today. Thank you for calling ahead. Have a nice evening.
Have a great night.
Hey Mary, Kelsey and I are going to be give you bedside report before I leave for the morning. We are just going to be discussing the plan of care along with general patient's summary of your history.
Feel free to chime in at any point to let us know what we can do for you or if you have any concerns.
Okay.
This is Mary Rascala, an 85-year-old female admitted on November 28th with a flutter. After imaging was done, they found a mass in her colon, and after a biopsy, it was confirmed cancerous. She is scheduled to have that part of her bowel resected later around noon today. She is MPO, is using a bedside commode, and is relatively independent. Her stool is clearing up.
And what are her vital signs?
Her BP is 134/65, heart rate 66, O2 96, and on room air. Temp is 98.9 oral, and respiration 16. Prior to her admission, she was feeling very weak and had reported feeling very dizzy. After reviewing her lab results, her HbG was 7.7, and she received 3 units of O-negative blood.
Oh yes, honey, I felt so weak. I could hardly walk to the bedside commode there behind you. My daughter and I looked on the Google, and apparently my hemoglobin is supposed to be between 12 and 14.
Yes, ma'am, it is, and yours was very low. That explains why you were so weak. Are you feeling any better?
Oh yes, dear, I'm feeling much better.
She has signed the consent form and have begun the OR checklist. Mary Rascala, do you have any questions or concerns you want to discuss with Kelsey or myself before we leave?
No, honey, I don't believe so. Thank you for taking care of me last night, though.
I will be back to do your assessment in about 30 minutes. However, if you need anything in the meantime, you ring your call light and just let us know what you need.
Hey Amber, I know you're the charge nurse and you made the assignments. I just wanted to let you know that I don't feel comfortable taking the patient load. 3 of these patients require a lot of nursing care, and I don't think I will be able to provide the highest quality and competent care for them. Would you mind rearranging the patient assignments?
No, Carson. You know, everyone has a hard patient assignment. Why are you the one that always complains about it? I mean, I know you aren't that qualified to work on the floor yet because you're new, but you should really get over it. Stop being lazy and trying to get out of doing your work.
I'm not trying to get out of doing my work. I just don't think it's safe for my patients who need a lot of intensive care.
Put on your big boy pants, Carson, and just do your work. Your patient list isn't going to change, and I think you should stop complaining.
Closing time.